year, and yeah, I guess from Lindsey mentioned it in January, we've had a lot of interest in menopause, and obviously that comes in lots of different forms for people, and very much we want to touch on skincare today, but we thought it was really important to back that up with specialists for hair, for exercise, for diet, and people who have been through this journey and have their own story makes it a lot more meaningful. So hopefully you will enjoy today. We are recording today. We do have a PowerPoint ready to come out to you guys after this session, specifically on SKINICIAN and skin, and how you can weave that into your treatments. And obviously that's a very tailored approach for everyone. So I have gathered some questions together. We'll work through these today. You guys have sent some questions in as well. If there is any questions as we go out throughout today, you can just bring up the chat box, and I'll keep an eye on it there, and we'll go from there. So I am going to introduce the panel. First up, we have Dani. Dani, absolutely delighted to have you with us, and Dani's going to tell us a little bit about herself.
Hi everyone, happy Monday morning. What a lovely way to start the week. I've no idea where you all are in the country. I'm in Surrey, and I love Monday mornings. My 3 children just walked out the door at 8 o'clock and the house is nice and quiet, and then I get to spend a morning with all of you. The reason I'm here today is I wanted to share a little bit from my personal and professional experience. I think menopause often gets a really bad reputation. We see all these pictures of women like this, or fanning themselves, and it's lots of advertisements. And although the menopause conversation has exploded, I think it's not positive enough, because menopause can bring with it lots of amazing and exciting opportunities and a real raw. And I think it's important that we hold on to that thought. It's a difficult transition when we go through it, for some, not for all, but there is this wise woman, I hope so anyway, waiting for us at the end of it. My own menopause was onset by surgery at the age of 39. I thought it was the end to my journey with cancer. I was diagnosed with breast cancer at the age of 33. My 3 little girls the twins were 2 and Rosa was 4. And so when I had lots of surgeries, chemo and radiotherapy, when I thought, yes, menopause, surgery, I'm going to remove my ovaries, this is going to be end of all of it, no idea did I have, or very little idea, that it would open another can of worms. And that is the one of my menopausal journey. And I'll share with all of you a bit more later, I guess, when questions come in. Or did you want me to talk more now?
That's okay. We'll do the intros, and then we'll come back, Dani. Thank you. We're really excited to hear about this, because it's such a different story, and you're so positive, which is great to see. Gillian, if we can introduce Gillian Killiner.
Everyone see me okay?
Yeah.
Hear me okay?
Yeah.
Great. So yeah, I am a dietitian. I qualified 25 years ago. I have spent 12 years in the NHS, and then another 12 years working as an independent dietitian, helping thousands of people. And the background to my story is where I actually got very sick with Hashimoto's in my 3rd pregnancy, and I realized that there's a lot of people out there that cannot find answers to long-term chronic ill health, and that's what I do. I am a jigsaw puzzle fixer. All the bits of your health and well-being is kind of laid out in front of me, and I put you back into a sense of feeling of well-being, looking at your diet, your health, and everything else. So that's kind of what I do and my background.
Thank you. Delighted to have you with us, Gillian. And of course, you all will know Lindsey, and Lindsey is joining us today. Far away, Linz.
Hi everyone. So I'm a little bit croaky today, so probably you're glad that you're not in a classroom with me and that I'm on screen. So it's lovely to be with all of you today. So for anyone that has spent some time with me on training, you'll know that I am a bit of a skin geek, and I'm very passionate about understanding how the ingredient actually functions on the skin to fix it. And I think whenever I'm asked a question about skin, I never give a black or white answer, which I'm sure is very frustrating at times, but we have to consider that we need to take a holistic approach to our clients and appreciate that during the menopause there's lots of changes going on, and it's not just that there's collagen reduction, there's also increased sensitivity, there's increased dryness, there's changes to the shape of the skin. So each person will have a very unique skin issue, so it's important that we look at them overall and then step back and look at SKINICIAN's ingredient deck and pick the right product that's going to help them achieve the best skin results. So hopefully today we'll be able to talk a little bit more about that and talk about how we can create a really amazing client journey for clients that really do need something that's slightly more specialized to their skin due to the changes that they're seeing. I'm delighted to be part of this panel, and I think it's going to be a really amazing learning experience for me personally, because having turned 41, I would say I definitely am seeing some major changes in myself physically already. So I think it is definitely a topic that we need to, as you say, Dani, be talking about so much more and making seem positive, because even though I'm kind of saying to myself in a mantra, this is fine, it's positive, you know, I still don't understand it fully. So I think, you know, I'm so proud to be part of this as a project.
Great. Okay, so let's get stuck straight in. Gillian, we're going to come to you first, and I think just to set the scene, perhaps you could help us understand from a medical perspective what perimenopause is and then what menopause is.
So, big question, big topic, affects so many different people, obviously female. That's why we don't get a great, I suppose, exposure up until very recently. Men really kind of belittled and didn't appreciate so much what women go through when they are facing hormonal changes. And as Dani highlighted, it can be from any age group due to a variety of different factors, whether it's genetic, whether it's infection, whether it's from cancers. But generally what perimenopause is usually considered is when you get these hormonal fluctuations through your progesterone, your estrogen, and you get some symptoms. You will still have periods, they may vary, they can be, you know, changing in length, changing in frequency, and also changing whether they're heavy or light. So that's kind of a very short little synopsis of perimenopause. Symptoms certainly can start with, you know, hot sweats, feeling of irritability, maybe brain fog, moodiness, weight gain is a big one, skin changes, bone changes, vaginal dryness. There's so many factors, there's so many women go through, but they're certainly the ones on the top of my head. Menopause actually is the term where it's your final period. So that's menopause, when a lady has her final period. Being menopausal is where you haven't had a period for 1 year. That's the terminology, that's the medical background. But like that, you can take medication, you can take HRT, and you don't have to go through a very nasty experience of hormonal shifts with your estrogen, progesterone, and there's testosterone as well. So, you know, ask me any questions if that doesn't cover it. I'm happy to expand, but I don't know how much medicine or medical terminology you want.
Thank you. Dani, if we can come to you next then, perhaps you can tell us a little about your journey, how you arrived at menopause, and talk us through your experiences and your symptoms.
Yeah, sure. I think so. By the time I then decided to have this removal of my ovaries, I was already a patient's advocate. I was already working with lots of women. And so I kind of knew how to navigate the medical system. And this is one thing I'd like to share with all of you. We need to all become much more difficult women and difficult patients. And if you think, I don't want to bother my doctor, I'm sure they're really busy after lockdown and with anything else, and my symptoms aren't that bad, so maybe I should wait, then please become a more difficult woman and a more difficult patient, and ask all the questions and make as many appointments as you need to get the answers that you want. I for sure made several appointments. So when I had my oophorectomy, the removal of my ovaries, I was really well informed. I had been really difficult up until then with my medical team And often I was just being told no. And I walked away and I thought, but no, why? And I want you to be asking, but why? And so just recently I was speaking to a lady who said, that can't be menopause. I've just got, it's almost like I've got period pain for 3 weeks out of the 4 weeks. That's not normal. We shouldn't be walking around having period pain feelings for the majority of our months and year. And so for me, I was really well informed. So I was entering menopause really well informed. And that's one of the things I want to do today. It's bridge the gap. In a way, I had the date in my diary for menopause. It almost made it easier. I knew when it was coming. The majority of women I speak to are actually living a reduced quality of life for not just months, but also years, until they either get the help or they decide, I'm just going to put up with it. That's the way it is. And that's not right. I do believe menopause is a natural transition. Some people say it's a hormone deficiency. I think it's a natural thing. And yes, we're deficient in hormones. But it's not right that we need to just do this without help. And that's the biggest problem I have with the whole menopause conversation, is that often women, you know, we often think natural childbirth, natural this, natural that, but actually it's okay to get help, whether that is from your GP, from a nutritionist like Gillian, from anyone else. It's okay to ask for help. And so I was the difficult patient, and I hope you'll all be difficult patients and women too, so that you don't have to suffer. Because if we have extended and prolonged periods where we don't function at our best, we won't be the best in our jobs and doing the best we can. It'll be really difficult to be a good parent. It'll be really difficult to look after the older generation. We're spinning so many different plates, and it's just a disservice to all women, I think, if we don't feel we can live our best life. Why shouldn't we?
Great. And did you have symptoms yourself then, Dani?
Yeah, so I decided to go straight on hormone replacement therapy the day after my surgery, which is a really difficult decision to make once you've had cancer. So I have lots of medical experts that have helped me arrive at that decision. And I also know it's a really difficult decision for a woman who is normally and naturally going into perimenopause. I work with many clients, often over several months, who have got their HRT on their bedside table and say, Dani, I still don't know whether to take it. Is it right or wrong? And so it's normal. I think it's absolutely normal. What happened for me until it was working, it was mentally, I've never had a hot flush in my life. I've always slept really well. I had a book deal with a publisher, an agent signed. Everything was running really well for me. And 6 or 7 months in, I called it all off. I thought no one wanted to hear what I've got to say. I thought I didn't have it in me. I thought, who would be interested in what I've got to write? And I kept having loads of self-doubt. I walked away from lots of, evenings out with my friends, and I've kept thinking to myself, gosh, I hope I didn't upset so-and-so. I hope Susie didn't take my joke in a bad way, or I hope I was fun enough. Maybe I'm the boring teetotal girl and no one wants to sit next to. I was riddled with self-doubt, but I didn't notice it because it crept up on me. And so I think for many of you who might be going through perimenopause and into menopause, naturally, we often don't know because it's such a steady and slow progression. And before you know it, you actually feel quite different, but we haven't picked up on it because it sort of crept up on us.
Okay, great. So, we're straight into talking about HRT. Gillian, there's one question here. Is HRT really safe?
Well, absolutely. HRT is going to provide your reducing estrogen. It can also support ladies who've still got their ovaries with progesterone, because if you've got your womb, because if you don't have a womb, you can take estrogen straight off without having a worry that the lining of the womb can become thickened. So that's what progesterone assists with. People who are in perimenopause can take HRT if they've got symptoms, and they can do that cyclically. Ladies who don't have periods then can take estrogen, progesterone continually. There's so many variations on HRT, and you've really got to work out what's for you, because if you have a history of genetic issues, liver disease, hormonal cancers, potentially, they can, by the nature of what your hormonal replacement is, you need to discuss that to make sure that you've got the right one. But HRT is safe.
Great, okay. And Dani, I'll come back to you in that. What might you expect through perimenopause and menopause around skin, hair? What changes did you see?
So I think it's really important to say that some people really don't see loads of changes. Some people have really severe changes that really, really need help because they stop them in their tracks. And we've got about 50% of women who experience varying degree of changes. And when you look at your own journey, perhaps, or lots of you are far off, but also your clients, sometimes the most important thing is just to open the conversation and say, how are you? What are you experiencing? Sometimes we just need to get it off our chest. For me, certainly my hair was becoming super brittle, super dry. And I hate saying it, but I did feel in myself that I felt a bit like a prune. It's awful, but my skin was so dry. And unless I do some skin brushing and really sort of get rid of sort of exfoliate, I really just feel dry in my skin. And of course, lines and all of that changes with collagen, just like Lindsey already has mentioned. That's a whole other conversation, isn't it? About how can I feel well in my skin, accepting all the changes? How can I still wake up and like what I see? And not always that is something that I need to say, I love all of my lines. Of course I don't, but it's a work in progress. But definitely the dryness for me, and definitely that dry hair as well.
Okay, and Lynn's coming to you nicely there. Can you talk us through what happens to skin during menopause then?
Oh my goodness. Oh my goodness. So yeah, no, there's lots of things. I mean, obviously collagen is one of the most obvious places to start because it's a topic that for the majority of people, they're aware their skin makes collagen. They've got a rough idea what it does, and if they don't, they still know it's fairly important that their skin has it. So throughout perimenopause, you can actually see something like a 30% reduction in the amount of collagen your skin makes. And then further to that, you are going to be losing, I think, in the next 5 years. So kind of post through perimenopause, you've got that 30% decrease, and then menopause and onward, you know, it's a further 2% decrease each year. So you're rapidly making much less. So for an aesthetic point of view, what we're seeing is that the skin itself is becoming a lot thinner. Lines and wrinkles are becoming a lot deeper, and you can also see a slight change in the skin color as our clients get much older. You can also see a slight yellowing of collagen, and that's caused by glycation, where sugar actually becomes oxidized. That's a totally different topic, but really that kind of lowering of collagen levels changes essentially the thickness of the skin. We also see a decrease in the amount of elastin that the skin makes. So we start to see some sagging in the skin's losing its spring and its snap. That can lead to larger pores. So, you know, we would often talk about pores are not doors, you can't open and close them, but we can dilate and constrict. But because we're making so much less elastin, to constrict the pore is quite difficult. So it does tend to appear to be more open. We also produce less glycosaminoglycans, which is a hydrator and a moisturizer within the skin. And that then leads to the dryness that Dani was mentioning. And some women get really incredibly dry hands and feet in particular, and need to spend a little bit more time moisturizing those areas of the body. Shelley, there's a whole list. I can keep going, or I can stop and put them more in as we go through. It's up to you.
No, I think it is a great discussion. What might people actually physically see in the skin? So for our therapists, for treating people, what might they physically see in the skin?
Well, they're definitely going to see, as I've mentioned, those deeper lines and wrinkles becoming more of an issue. Now, of course, the amount of sun exposure that person will have had throughout their life will make a difference as to how dramatically obvious that is. But that's definitely something that people themselves will probably notice, and therapists will notice if they've had a long-standing client throughout those changing years. Definitely more visible blood vessels within the skin as well. The skin can appear a lot thinner and more fragile. And clients that maybe would have generally had quite a hydrated skin might now suddenly be experiencing increased levels of dehydration and possibly at times some sensitivity as well. So it's really important that they use their SKINICIAN consultation document and spend time understanding, what the client is recognizing first and foremostly changing on their skin, and then using their SKINICIAN skin analysis to kind of merge what they're seeing with the information they've been given together to make the right choices. Because it's very, of course, if anyone says to me, I've got lines and wrinkles, what should I do? My immediate response is going to be, well, age-less overnight retinol power by 1 or 2. But if I'm somebody going through perimenopause, I can't immediately jump to that, because actually my skin has perhaps not got a great barrier. So to jump straight into that without making an assessment of the dryness, the dehydration could lead to more issues. So it's very important that they do establish the sensitivity levels for that skin before making any decisions as to what that person should be using. I should also say, sadly, in perimenopause, those of us who maybe suffered with acne or escaped acne throughout our whole lives may suddenly start to see more hormonal breakouts around the jaw, and the type of breakouts that therapists will tend to recognize. And as women, we recognize they're no longer small red spots, they're large pulsating lesions on the skin, and they tend to be repeat offenders. They reappear in the same areas, and that can be to do with lowering cortisol levels, which is the hormone involved with stress, and also estrogen has generally a very therapeutic effect on testosterone, and when we don't have as much of that, the testosterone has obviously a bigger impact on the behavior of the skin. And what's really interesting is that actually it's the hair follicles around the jawline that are more sensitive to this fluctuation in hormonal levels, which is why we get the breakouts around the jaw specifically. And it's also why some women experience terminal hair growth, so those darker, stronger hairs growing in those areas as well.
Yes, so there's quite a bit going on for everyone. Gillian, it was actually a conversation that we had when we first met around post-COVID and the changes that you were actually seeing in female health. What have you actually seen in the past 2 years, and how might that differ? Oh, we can't hear you, Gillian.
Yeah? No?
Yes, yeah, that's it.
Really weird. So sorry. Yeah, so COVID has brought about a lot of significant changes for us all. And I think a lot of ladies actually welcomed having time at home, maybe having a chance to do things that they'd never done before, like cook from scratch and rethink things that they, survived on, shopping, coming into the house, always on the go, rush, rush, rush. And so there were some positives, but yet a lot of ladies did struggle post-COVID if they actually were sick with COVID. It increased inflammation, long-term health issues became more apparent, hormonal shifts were a big thing, and histamines, gut health, they all came to the fore. And so, yeah, I've been dealing with a lot of people in the last 2 or 3 years that have never seen as many histamine issue patients as I have, which obviously then has an impact on histamines affecting the eyes, the skin, their feeling of well-being. Yeah, it's just been miserable for a lot of people. So in a nutshell, yes, COVID has had a positive and a negative impact on a lot.
Great, thank you. And from a dietitian's perspective, what are the key ingredients then for good or bad gut health?
That is the number one area that actually I always start with. It's one of the big significant things that people actually overlook. They think they've got a bit of reflux, they might have a bit of sore tummies, burping, wind, bloating, diarrhea, constipation, and they put up with it. They think it's normal. They think it's, just part and parcel of getting older or what they're eating. And actually that gut dysbiosis has such a knock-on effect on inflammation, sleep, mental health, their appetite, their ghrelin, leptin, their sense of well-being. So when you're looking at gut health, it really does impact also on how you absorb your nutrients. And a lot of people I see are very deplete in key nutrients. And certainly going into the menopause, you want to be optimizing those micro and macronutrients. And a lot of ladies are doing way too much exercise, under eating, and creating this vicious storm of dysbiosis, but also hormonal imbalancing in other ways. So their adrenaline is up, their cortisol is up, and they just can't settle and rest. So in terms of their gut health, you really need to just bring it back to baseline, find out what they're doing. A lot of ladies, again, are misinformed, and they're trying to establish this kind of low fat diet. And actually we need healthy fats very much so when we are going to be aging. Our bodies need these omega-3 fatty acids, which are anti-inflammatory, and we get this all from such great varieties of foods that these ladies are not eating. So I try and actually debunk all of the issues around good quality proteins, good quality fats. They are not demons. They need them alongside excellent sources of micronutrients, selenium, zinc, vitamin C. They're often overlooked, and people are too bland and too beige in their food choices. And that's really driving a lot of unnecessary aging, and gut being the major part of all of that as well.
Okay, and you just touched on exercise there. So I think there's over exercise and then not enough exercise. Have you any hints or tips, or what is the kind of advice that you would be giving to your clients?
Yep, exercise. I think when I was a youth, so when I started as a dietitian in the 80s, 90s, it was all cardio. You've got to do X number of hours doing cardio. And actually the shift over the last 5 to 10 years, you'd have looked at ladies who were doing weights and you're like, no, gosh, that looks just nothing suitable. But actually we need to strengthen our bodies. We need to do, whether it's weight bearing, our own weight, doing exercises with not extra weights, but ladies now are, really seeing the benefits of weight lifting, small weights, heavy weights, and getting that strength and stamina. It really makes such a difference to long-term health and well-being, as well as eating well, drinking fluids, sleeping well, keeping stress down. They're all the key pillars to allowing you to get to a good place. And too much cardio certainly can put stress levels up. We wake up with our cortisol at the highest. If you're getting up in the morning and you're not eating and you're going for a full-on what's that cycling where people go on bikes, I can't think, spinning, you are really putting yourself under a huge amount of additional stress that we actually don't all need. So yeah, I am not a massive pusher on high intensity all the time. You need to vary it, going for walks, mental health, get out in the fresh air. Don't beat yourself up if you aren't doing a cardio session every day. A couple of times a week cardio, a couple of times a week weights, every day get out and get some walking.
A balanced approach to everything then is what you're saying.
Absolutely.
Great. There's been a couple of questions come in. One is, are there foods to help with insomnia?
Absolutely. And it's actually looking at you as a whole, because when I get these types of questions all the time, there is no good or bad foods. There's no good or right way of doing things. It's looking at what your life is like, stress, work, time, sleep. They are all so important to get right. And eating well, I feel, is not about packaged foods. It's all about creating foods with good choices, good proteins, whether it's vegetarian, vegan, or meats, fish, pulses, eggs. They're all really valuable. Lots of colorful fruits and vegetables, good quality fats, so your olive oils, your avocados, and making sure you've got long-acting carbohydrates, so you're not spiking your blood sugars. That will keep most people very happy, stop cravings, allow good sleep. We create sometimes issues around not eating enough, and then we get to a point in the night where actually our cortisol drops and we wake up because we're hungry, and then it's a vicious cycle. So we need to fuel our bodies correctly, and at nighttime having a bit of protein before going to bed if it's something that you do have an issue with, getting good magnesium on board. They're all really important for allowing the body to settle, rest and digest through the night. Well, not digest, you don't want lots of digestion, you want rest and repair.
Okay, great. And I assume that would be very similar to low moods and irritability.
Agreed. Yeah. I mean, this is the thing. It's really useful to just go back to baseline. It may take some changing the way that you shop, the way that you look at how you make things easy as possible, but it is a matter of allowing you to get as natural choices in as possible. Like, no one's perfect. You have to have some amount of packaged foods, but it's picking the most if you can see the ingredients list and there's not 100 different ingredients in that package, you're doing well. If you can read all the ingredients in the package and they all make sense and they're natural, brilliant. So yeah, it's avoiding those types of crazy processed choices 90% of the time. Then you're okay with the rest of the bits and pieces that you might have to eat.
Thank you. Dani, what about yourself with diet and exercise? How did you navigate that yourself?
You know, I think it's really important to sort of say, when you're going through perimenopause and then into menopause, we can often feel really quite rubbish. You might have a whole achy body, achy joints, you might have put on weight, you might have headaches, migraines, fatigue, irritability. And you might have clients like that are coming to you with their skin problems. And then we might say and mean really well, oh, why don't you eat better or exercise? And sometimes all of our symptoms are preventing us from doing that because we haven't got the energy to go shopping and to change our diet. And we haven't even got the energy to go out for runs because our body stops us. And I know what it's like when you've got really bad joint ache. The last thing I was able to do is go and exercise. So sometimes it's really important to think, where do I start? And to be compassionate and think, what is within my capability? And perhaps you need to address your diet and your lifestyle first. Perhaps you need to go and visit your GP first to set yourself up so that you're able to do so. I really feel we need to be much more compassionate when we speak to one another, because some of the things are just too hard to manage. And I love what Gillian just said about gut health. Ever since my diagnosis 9 years ago, I was become obsessed with gut health. And one of the things I do every single day is have a shot of kefir, which is a fermented yogurty drink, and I have a spoonful of sauerkraut for my gut health. You never need to buy a really expensive probiotic, but if you do those things, your gut health, I always think your gut health and your tummy is a little bit like a rainforest. So the more you feed it with the bigger variety, the better. And of course, if you've put on weight, if you're feeling sluggish, you're going to think, oh, I just need to reduce my calories and then I shift a bit of weight. But actually, we need a lot more. So if our focus is on, I mustn't eat, I mustn't have the chocolates, it's just going to expand. But if our focus is on, how much more can I eat? A bigger variety of fruit and vegetables and whole foods. I think we're going to get the balance right without depriving ourselves. But before we address any of that, I really think we need to be so compassionate about, how do you treat yourself? How do you speak to yourself? And if you haven't got the mojo, if you're feeling too fatigued, then it's okay, because this is perimenopause, and menopause can make us feel that way. We just need to get the right help.
Great, thank you. There is also a question, Gillian, on any herbal remedies you can recommend.
Oh, there are lots of herbal options out there. I am a big advocate of keeping as natural as possible. I'm a supplement geek. A lot of people come to me, and very much like Dani says, it is about looking after yourself, not beating yourself up if you're not well. I mean, from when I was sick with my Hashimoto's, which is not menopausal, I couldn't walk, I couldn't talk, I couldn't do anything. I had 3 kids. I run a business from 8 in the morning till 10 at night. I was a runner. I have a disabled parent who I care for 3 hours away. I couldn't do anything. And, you know, building myself back up took a lot of work, effort, and confidence and self-belief that I could actually get better, because I didn't think I would. And yeah, you go through such trauma and turmoil and doubt. But in terms of supplements, I became very much in tune with that, because you can spend a hell of a lot of money on stuff that's full of terrible ingredients, and the therapeutic dose is so minor that all the other ingredients outshine anything that might have been good in there. So the whole idea of looking at supplements, I think you need to get the diet right, the lifestyle right. You know, you can do really well menopausally without necessarily having to do a HRT. You know, it's not the only route forward. You can, you know, get through menopause quite nicely if you're lucky enough to do so. But supplement wise, it would be the baseline things, like even just make sure you've got the vitamin D. Your vitamin D is so important. It's an immune regulator. It also assists bone health, a mood. It's a serotonin upregulator. You know, we need it. We don't get enough from our sun because we're terrified we're going to get skin cancer. Actually, that's not so much, you know, if you can get 10 or 15 minutes without burning, obviously not in Northern Ireland because there's no sun here ever, but everywhere else, if you're in the sun, it's great. And then take a supplement. And actually, one of the things that people overlook is they take high doses of these supplements and don't really know what the balance is. So, you know, synthetic supplements aren't really the right way to go long term. I see in my practice many patients, sadly, who've taken long-term high-dose supplements and they've given themselves liver failure. So, you know, you really do have to be mindful of what you're doing. These fat-soluble vitamins do not leave the body, and therefore you really want to be working out what's best for you. So in terms of menopause, yes, there's simple baseline bloods that you can get also to check your vitamin D status, your B12, your folate, your ferritin, your iron. They're all really important to get right. Then in terms of other things like Agnus castus, there's black cosh, there's evening primrose oils, there is red clovers. They all do mimicry of hormonal, the way that our bodies would work. Unfortunately, as a healthcare professional, I'm not going to be able to say categorically they are the right thing for everybody to do. I think it's something that you will have to investigate, decide what your symptoms are, and take that opportunity to maybe go with something. Certainly evening primrose oil, soy products, flax seeds, they're not abnormally going to be detrimental to your health. They could actually be very assisting for mimicking estrogen. So if that's first and foremost where you go, brilliant. But taking some of those supplements that, you know, I've just mentioned, there's no regulatory research on them, so I couldn't say categorically they'd be the right thing to do.
Yeah, great, thank you. Neve has just sent in a question: histamine reactions, what can we do if we're experiencing these?
So if there's a high level of histamine in the body, it is very tricky because your skin's immune system is on high alert. It feels like it's under attack, and nearly everything that you put on your skin is going to potentially cause a bit of a reaction. So the first thing to do would be to strip your skincare right back to the basics. So, you know, stick with maybe your cleanser and a moisturizer. Make sure obviously your moisturizer has your SPF and your hydrators in there, but keep what you're putting on your skin to a minimum to try and allow it to feel calm, if that makes sense. Because if you can imagine that your body thinks it's under attack and you keep putting lots of different ingredients onto the surface of your skin has to come out to see your immune system. Okay, your immune system's a bit like the emergency services. So when something has gone wrong somewhere, it sends out the trips to try and investigate to see what has actually happened. And that's what's going on when there's lots of histamine within the body. So each time we load more into the body and onto the skin, your body has to decide whether it's safe or not. So there's that constant kind of investigation going on. So keep the home care, keep any treatments you're having to a minimum. You know, good cleanse, something like your revitalizing cleanser, which has got the chamomile in there, which is very calming and soothing, and your appropriate moisturizer. Something like the Advanced Time Delay Day Cream is again very good because you've got things in there that are combating any concerns that you might have around aging. They've also got things in there that leave the skin really hydrated, so it's helping to combat dehydration. It's got the SPF. So that would be my suggestion. Keep it simple. Let the histamine levels become lower, and then you can start to slowly introduce more actives into the home care routine and professional services.
Thank you. So just before, Lindsey, I'm going to come back to you in a second, just with regards to treating clients and on how you know, our therapists and facialists can actually help their clients with regards to skincare, and you know that as Dani says, that wider connection I just want to touch on brain fog and memory loss. Dani, Gillian, if you guys want to touch on that.
Shall I go first? I'd just say, you know what's horrible when you are in mid-sentence, you're looking at someone and you can't remember the person's name, when you are in a work meeting and you can't remember where you just stopped. I'm recording lots of podcast episodes and sometimes I have so many edits because I just can't remember what we're talking about. It's horrible. One really brilliant thing that we've known from a fantastic neuroscientist in America, Dr. Lisa Mosconi, is brain fog is real. There are real changes in our brain in perimenopause and it will recover. So it doesn't mean it's going to be poorly for a long time. So you might just think actually that feeling is horrible, but you knowing that you're not going to go, that you're not going mad. Many women I speak to actually think they're going to have, that they have dementia, the onset of dementia. That's how bad it is. And it's a real worry for them, especially if you have a parent perhaps with Alzheimer's or different form of dementia, but it will recover. And I think that's one of the most positive messages I want to sort of get across. It will get better. And of course, by eating, like Gillian said, a lovely diet, a Mediterranean diet with lots of pulses and fruit and vegetables is a really good way. And it's actually proven to really support our brain health long-term, not just going through the change, but also for long-term brain health. It's the best thing we can do.
Any recommendations?
Yeah, I would agree entirely. And certainly brain fog can also be related to issues where we have intrinsic factor issues. So you have intrinsic factor in the lining of the cell of your wall in your gut. And intrinsic factor allows vitamin B12 to be utilized. And many ladies, for a variety of reasons, that can be depleted. So you're not getting your B12 levels correct. Folate can be depleted if you don't eat enough fruit and veg. And so they can actually contribute to brain fog as well. So you do need to make sure that you are actually optimal in the right things that you're doing. The fish oils, fatty acids, really important for brain cellular structure because our brains are made up of 80% fat. So yeah, agreeable. And that's actually the saddest thing for me is so many ladies I see in their prime at work, the brain fog stops them because they're so embarrassed and so fearful that they're going to get it wrong. And that's what I try and prevent for them. I treat them in the way that they can get back as quickly as they can to feeling optimal and dealing with it because they know it is, as you say, transient, Dani.
Great. So Lindsey, if I come to you, just some advice on treating clients and how we can help them on their journey with menopause.
Okay, I think probably actually a really nice place to lead in is the brain fog and the forgetfulness. I mean, as a therapist, you're standing at your front desk looking at this appointment going, where is this client? And, you know, why are they not here? So, you know, thinking about confirmation calls, first and foremostly, you know, or a quick text message, you know, if you're aware that perhaps hormone levels are fluctuating or you've noticed a slight change in your client's behavior or their appointment pattern or they've started to become late, you know, a little message the day before in the morning just to remind them that you're looking forward to seeing them is a really great idea because it might be that, you know, at that particular moment, they remembered in the morning but they forgot at lunchtime. And that can happen anyway, but it will certainly help the client because they want to make the appointment, but also the business because then they have that person actually coming in. I think the other thing to consider is how we're setting up our treatment spaces. We all love the idea of a nice fluffy heated bed and, you know, we get our clients under the duvet and, you know, all of that and the fluffy blanket and that, I mean, that ordinarily is fantastic. But if you are perimenopausal and one of your symptoms is hot flushes, that could actually be a really horrendous treatment because you're lying trying to pull all of this off. So, you know, perhaps considering not having the heated bed on, having lighter layers of materials available so that you can take them away more easily if people are uncomfortable in the treatment space. Making sure you go through that consultation, as I've already touched on, so that you're really taking the client's whole situation and every symptom into perspective, so that holistic approach and choosing ingredients appropriately to deal with that. So if you're looking at somebody who perhaps is experiencing really high levels of dryness on the skin, they're perhaps seeing that the blood vessels are very permeable, you're going to go with something a lot more calming and soothing and nourishing and protective for the skin. So I'm thinking things like, again, revitalizing cleanser, our advanced calming serum with our calming botanical complex in there, things like your advanced repair mask with the phytosoothing ingredients, so our environmental matrix defense ingredient that helps to shield the skin from environmental damage would be brilliant. Getting them to introduce the daily body lotion on a daily basis or as often as they can to try and target and treat the dryness around the hands and the feet. The body scrub is a great one as well, because one of the symptoms that we see in the skin is that there's a thinning of the skin and the subcutaneous layer, which is the fatty layer, changes, and that does make cellulite more visible. So, you know, gentle buffing and exfoliation of those areas 2 to 3 times a week, maybe even doing daily body brushing and following with the daily body lotion, be really helpful at home. If it's someone that's maybe experiencing more of the slackening of the skin and the deeper lines of wrinkles, then we're possibly looking more toward those advanced services, such as our intensive glycolic pig plus treatments or your ageless AHA lactic acid, where we're really looking at trying to stimulate the skin to produce those dermal proteins that it has slowed down in terms of its production. So getting the collagen, getting the elastin, the glycosaminoglycans back and up, working at optimum level. And at that point, really looking at introducing your appropriate ageless overnight retinol power band, whether it be level 1 or level 2, to continue those results at home. So all of those things should really help the clients see a change in their skin. Obviously, how quickly they see that change will be different for everybody, and making all of the other changes that the ladies have mentioned as well in terms of diet will really be helpful for their skin too, because if we're inside healthy, then outside does look naturally a little bit better as well.
And do you mind, can I just add something to this, Shelley? Would that be all
Sure.
right?
Yes, please.
I just wanted to share from personal experience, but I've recently had a facial where I live near Kingston, and I'm sure the therapist was meaning really well. And we just, I don't know, it came up, but I can't go into my whole history of why I've arrived in menopause. And clearly I don't want to with the majority of people. I choose who I talk to about my personal experience. And this therapist was very well-meaning and spoke to me about all the things I could do to help my menopause. And she's it's really annoyed me. And I was so pissed off, I will never go and book at that salon again. And I'm sure she was very well-meaning. But for someone who works with hundreds of people in perimenopause, menopause, with or without cancer, the one thing I need to say to you, because I'm sure after this, you will be very well-meaning. The most important thing is that we keep this a judgment-free space. Menopause is never a this or that approach. Some women have the healthiest of lives, diets and exercise, and horrendous symptoms. Some women go on HRT and it doesn't work for them, and they might have tried lots of things. It's really important that you remember you don't really know anything about this person. Even after speaking to a client for 3 or 4 hours, I hardly know enough to make a judgment on anything. The most important thing you can do is just have the conversation. And just like Lindsey said, it's just for you to say, shall I put the heated blanket on or not? Because I know, you know, there might be hot flushes or not. Just tell me. Just opening the platform to let your client tell you, I think it's the best thing you can do, and stay judgment free, because you can really wind someone up. But by opening the conversation and by listening, you give them an opportunity to say what they want, and then you can have an actual conversation. And I think it's really important to remember that. Thank you. Sorry for interrupting, Shelley.
Not at all. But I think, you know, you are right in what you're saying. I think as a skin therapist, the advice that I will provide will be skin related advice. And, you know, whilst throughout my training and my experience, I have had some you know, learning or information about medication and health and wellness and diet, I don't really know anything about those things, you know. So yes, I can say we should eat healthy fats, and yes, I can say we should think about exercising to lower our stress levels. What I know I can do is give proper advice about skin. So I think for every skin therapist out there, it's remembering that that's what we're there to talk about. It's to treat the skin and to give the right advice and link the correct product to the skin issue that person is experiencing, and then direct clients that need that other support to the appropriate people like yourselves to get it. And I think, you know, I know the SKINICIAN therapists we have, they love their clients and they really do want to look after them. And I'm sorry you had such a terrible experience with your facialist. I hope that not everyone has that, you know.
No, you know what, Lindsay, I think menopause is such an emotional thing, isn't it? And that lady, she just wanted to also share from her experience, and you can't help sometimes to have a great chat, and before you know it, you've maybe, you know, it goes off. And really, I went to her for my skin, like you say, and yeah, so it just is to be mindful, isn't it? We know so little about other people. I always need to remind myself of that.
I think, yeah, no, absolutely. So coming back to that, I think, you know, the PowerPoint that will be shared after the presentation will be so informative in terms of the ingredients that link to each of the issues, and it's been done so beautifully by the design team at SKINICIAN that you can see, you know, each of the skin issues that could potentially arise, and then the ingredients and the products that are appropriate to that. So it'll be such a useful tool for all the SKINICIAN therapists out there to use to really help their clients. And I personally really enjoyed doing the research behind it to pull it together. I'm so excited to see that at SKINICIAN you really already have such an arsenal of ingredients to support the skin changes that we see through perimenopause and beyond. Because, you know, for me, the skin is just a constant changing, evolving organ. It is the largest living organ of the body. And, you know, whatever's happening internally does affect what it looks and feels like externally, and equally what's happening externally affects how it feels and looks. So it's, you know, really understanding how the client feels about their skin, and then how they want to treat it and what's best for them. And that can only happen through a really thorough consultation and understanding what you have on your treatment trolley and on your retail shelves, essentially.
Thank you. And actually, Gillian, whenever we were talking, we were very much about this is for our salons to be able to actually recommend where to go and get help, and that actually diet, skin, hair, everything, it's an overall approach, but it's not for our salons to be giving advice on those. This is just a general overview, and actually that they need to seek proper help with X, Y, and Z.
I think the big one here is the more you know, the more you realize you don't know. And as the whole point of the reasons why you are trained in what you do, someone else is trained in what they do, is because you have to repeatedly know that there is no two people the same, ever. And you can say one thing to one person and it would be totally wrong. It's like, you know, we touched on exercise. We didn't even mention that, you know, there's some people who do ultra marathons, they're Olympians, they're taking 4,000 calories a day. You know, that's one extreme. And then we have the people who can't get up off the sofa, who can't do the things that they need to do to just get, you know, the next basic meal. So the spectrum is so big that you cannot ever give broad generic advice without kind of, maybe insulting someone. I see it all the time. I go out with my friends, I go to different places, they hear I'm a dietitian and they tell me, oh my goodness, you should be taking this. And I'm like, oh, okay, you know, you stand back and you say nothing, because actually what you've picked up from the tabloids today will be a totally different message tomorrow, because the science is never settled. That is the best term I learned many years ago. It's like alcohol. Drink 1 glass of wine, it could be therapeutic. Drink 2, it's toxic. Depends on the individual. Are you a 4'11" ballerina, or are you a 6'3" rugby player? They no comparison. So you have to really work at picking the right things for that person. It's the same exactly as the skincare. Everybody's so different. And actually the histamine side of things, actually, if you really do struggle with people who've got histamine related skin issues, it's fixing the gut. They usually don't have DAO enzyme, which is diamine oxidase. And so, you know, struggling with skincare and you trying your best to deal with that skin, not necessarily, it needs to be fixed via the gut as well. So that can help too.
There's a question here, Lindsay, on rosacea and menopause and the connection, or what kind of products would you be recommending there?
Okay, well, rosacea is a tricky one because there does have to be a genetic link somewhere. It is a genetic skin disorder. However, when we are in perimenopause, because of the changes in the blood vessels, it will potentially become.
Whoops. That just disappeared there. I think she's actually cut out, so we'll just wait for Lindsey to come back in there. Let's see what else we've got. We have hot flushes, hot flushes, night sweats, which we actually haven't touched on, and the best way to deal with them. Dani, I don't know if you have any experience.
Yeah, I think it's a combined approach, and little things that we can do every single day throughout our day can actually make a big difference. But often we don't believe in those little things because they're easily to be dismissed, because often they're free as well. So for example, not having hot tea, hot coffee in the afternoon can make a difference to you having a night sweat, because our body has a certain rhythm, and sometimes it stores up all the heat and then whoom, releases it at 3 o'clock in the morning. And so you might think your night sweats are terrible. So by just reducing the amount of hot drinks in the afternoon, evening can make a difference to what you're experiencing at night. Ventilating your rooms, ventilating your treatment rooms, wearing really comfortable clothing, all can make a difference. Staying away from spicy food, from caffeinated drinks can make a huge difference. Many women even say that by eating red meat, they feel that their hot flushes can become more severe. And so the most important thing is to really become more aware of what's going on for you, and do you see if there is a pattern? Because the more in tune you are with yourself, the better. And one of the things I love so much about you and your brand and all of the facials and treatments you do is, I think we need to learn a little bit of self-care again. So many of us in our 20s and 30s and 40s, we run around like headless chickens. We're spinning 10 different plates at the same time. And we don't really allow ourselves the time to go and have facials, to go and have treatments. And so in my 40s, I've really only had to relearn that it's not just a luxurious experience to go and have a facial. It's absolute self-care, is absolute detrimental to my overall health. And so the more time you allow yourself to just be blissfully maybe having a treatment on your face, you can then become more aware of, when do I have hot flushes? Is there something I can do about it before I maybe have to go and seek help from the doctor? But there's lots of lovely cooling recipes. Like if you suffer with hot flushes, you want to stay away from gingery drinks, for example. Although I like ginger, I can really feel how it fires up my body. So you might be drinking mint teas and cooler beverages throughout the day. And I think often we dismiss those things, the same what Gillian said earlier about sleep hygiene. We try a sleep hygiene. If you suffer from insomnia, for example, you try putting your phone away and not watching the television before you go to bed. You try it for 3 times and then it doesn't work and you give up and you go, oh, it doesn't work, I've tried. But if you're on medication for whatever, you're not just going to take the medication for 3 days. And if it doesn't work, then you're going to stop. We're going to be on that medication. And so if you're trying to do something about your hot sweats, your flushes, you're not sleeping well, we've got to also be consistent. And that consistency sometimes only pays off a little while after. So I think this is really our invitation to get to know ourselves again and not just think stubborn symptom, how can I get rid of you? It's really thinking, what is going on with me? When am I experiencing these hot flushes? Are they actually really bothersome? Or maybe 1 or 2 a day and it is okay for me. We're all different in when we need it to be sorted, really.
Great. And Gillian, any tips on hot flushes?
Yeah, absolutely agree with Dani. The whole looking at the picture long term is so vital. But evening primrose oil, there's been studies to suggest a gram of or 1,000 milligrams of evening primrose oil can assist with certainly nighttime sweats. It's a phytoestrogen kind of aspect to it. You can, certainly consider that as an option, but that's probably the most science on those. But definitely getting your right nutrients, baseline health and well-being, it will help with minimizing them. It might not get them completely sorted. And actually sugar control, blood sugar control. If you're really eating a lot of rubbishy fast-acting carbohydrates, they will also impact on your insulin and cortisol and raise that sense of jitteriness, but also sweats. So not so good.
Great, thank you. Okay, we have Lynn's back. We'll come back to you, Lynn. You were on rosacea.
Sorry, technical issues. So yes, as I was saying, rosacea is a hereditary thing. However, as we go through perimenopause, as we touched on earlier, the blood vessels become much more permeable. So it is potentially going to become more of an issue, because the problem we have with rosacea is this continuous flushing and blushing on the skin. And that continuous flushing and blushing on the skin actually weakens the vessel wall. So the other issue is, of course, we're making much less elastin, which is what the little blood capillaries are really made from. It's what gives them essentially their ability to dilate and constrict. So if they're weakened and we're not as strong as they should be, and we suffer with rosacea, I suppose it becomes a more constant battle then, that you look more red and flushed more regularly. So certainly some of the things that Dani, you were saying whenever I came back on about thinking about sort of food you're eating. So we would often suggest that a client would keep a flush and blush diary if they have rosacea, to help them identify what are their personal trigger factors. So if it is drinking, a glass or two of red wine, and they notice their skin's gone red for 2 or 3 days, or even a couple of hours, that might be something that they consider not doing so regularly. Equally the same with food. So after a couple of weeks, they can clearly see what's actually making their skin flush or blush, and taking those trigger factors or minimizing those trigger factors as much as possible is really important. When it comes to skincare and rosacea, avoiding anything that's got really heavy oils included within it. So the oil on top of the skin can actually trap heat and make the skin flush and blush for longer. So you're looking for more lightweight products. And again, you can tell that Advanced Time Delay Day Cream is one of my favorite products. One of the amazing things about that particular moisturizer is that although it's an anti-aging moisturizer, it hasn't got that stereotypical thick base. It's very hydrating and nourishing for the skin without being thick and heavy, overly rich. So if you are trying to treat aging and you do have rosacea, that moisturizer is going to be perfect for your skin, because it's not going to trap the extra heat. You might want to consider removing water out of your home care routine and using the revitalizing cleanser as a wipe off. Or if you do enjoy using water, perhaps you're someone who's noticing you've had more breakouts and you've swapped on to the purifying cleansing gel, that's fine, but just make sure it's tepid, not too hot, not too cold, so we're not again causing those blood capillaries to either dilate and constrict too quickly. Making sure you've got the SPF on every day. All things that will really help. Again, the revitalizing toner is another great one to cool and calm the skin if you're noticing it's red, or if you are having a hot flush, again, that can help to cool the skin and leave it feeling a little bit more refreshed and refresh your makeup, so you just look and feel a little bit more, I suppose, a little bit better in yourself. I hope that has been helpful. The Calming Serum, I'm sorry, cannot forget Calming Serum. Calming Serum, we know, will give really quick results in a very short time. We always say that you need a full kind of 4 to 6 weeks with a product to see any change in the skin. But Calming Serum, I'm going to be really brave and say, you can see it very quickly. It might only take a couple of days before you immediately start to see that actually the redness won't have gone away completely, but it will definitely have started to reduce. So to just put that into more of a bullet point bit of advice: flush and blush diary to identify trigger factors, minimize and remove them. Make sure the water you're using on your skin is tepid, not too hot, not too cold, or potentially eliminate it from your home care routine altogether. Keep a revitalizing toner on hand to keep the skin hydrated and to reduce any heat or inflammation throughout the day. Use a lightweight moisturizer that's going to hydrate and of course has your built-in SPF, and Advanced Calming Serum morning and night for best results.
Awesome, thank you. One more, it's actually come up quite a few times from a skincare perspective, Linz, is that saggy chins, wrinkly necks, that jolly look around the jawline.
Yes, so that happens because of the reduction of elastin. So obviously the reduction of collagen, it doesn't help either, but the reduction of elastin and the way our elastin is placed in the skin can change as we age.
So a lot of products that we use are very focused on stimulating collagen production, because that again is what customers, our clients, they all have heard of, and they are seeking out a way to replenish it within the body and within the skin. But if your elastin fibers are under pressure and you don't have enough of them, then you can put as much collagen on as you like, but it's not going to target that sagginess that you're looking to get rid of. So my opinion would be you need to be pointing your clients toward our advanced firming serum. And I know Fiona likes to bathe in advanced firming serum. I can see her on camera smiling there. So your advanced firming serum contains a peptide called acetyl dipeptide, which actually stimulates the production of elastin. Not only is it stimulating the production of elastin, it's actually ensuring that it is architecturally created correctly and placed correctly within the skin. So what we can see due to free radical damage during the aging process and increased sun exposure is that elastin fibers, instead of being little springs, become broad flat sheets. And that's for some people why they get the lines this way in their skin, as well as horizontally and vertically, because that elastin isn't architecturally correct. So with the SKINICIAN Advanced Firming Serum, you get a great burst of elastin production, but also placed correctly in the skin and the right shape.
Okay, we have a couple of questions around hair and hair loss. Dani, do you want to touch on that?
You know what, hair loss is a really difficult one, because so many women don't want to talk about it because we're quite embarrassed, and it's actually much easier to go for facials because we're used to do so. And even I speak to women who go to the hairdresser and are quite embarrassed to go to the hairdresser because thinning hair is a thing, and it doesn't just happen when we're in our 60s and 70s. It can happen anytime from our late 30s, 40s. For those who have had children, you will know the hormonal changes after pregnancy. Often we lose hair around the corners here, and that's quite normal after you've had a baby. So when our hormones fluctuate like roller coaster crazy in perimenopause, it's really normal for our hair also to fall and to thin. And one of the biggest things for me was, because when I lost all of my hair never grew back fully after chemotherapy. My husband actually set up a whole new business because of it. And it's one of the things I'm most passionate about talking is there is so much opportunity in menopause and in perimenopause. And I'll come back to answering your question, but menopause is a real rite of passage, and we need to decide how we want to live it and how we want to get out the other end. It's not for anyone else to decide, but just for us, because society tells us we're going to be teenagers. Yes, you go through puberty. Then society will send you to school, right? We're going to all have our education. Some have further education. Then we work. And then society has no plan for us. So we often fall off that cliff. And unless we decide how we're going to age, what we want out of that next chapter in your life, how do you want to be in your 50s, 60s, and 70s? No one else is going to do it for you. And coming back to becoming more difficult as a patient, when you have thinning hair, it's a really good idea to go to your GP, just like Gillian said earlier, just have your bloods done. Iron, B12, vitamin D, all of those basic vitamins need to be in place for us to have good quality hair. It's also important to look at your hair care routine. Most likely something you have done for the last decade isn't working for you now. Like Lindsey just said, we need to adapt our skincare with the lovely firming serum. We need to adapt our hair care. Maybe you've had one of those old-fashioned hairbrushes that has been pulling your hair out, and you've got more hair on your brush than actually on your head. So really look at all of that routine as well. One thing from our hairbrush business that we have seen, it's really important, is when women experience hair loss in perimenopause, they often stop brushing their hair. And it's really common. Something like 87% of women say they just don't really brush their hair anymore. And we've done studies on thousands of people because they're worried that by brushing their hair, they'll pull more hair out. And so they just do a bit of this. And that's exactly what I said to my husband. I'm not going to brush my hair anymore. I'm just going to run my fingers through it, hoping that I pull less hair out than necessary. But what we're actually doing by that is not stimulating our scalp health. And if you think of how much attention we put into our skin health, if we have hair problems, it just makes sense to stimulate our scalp health as well. And so keep washing your hair. It's definitely one thing I had to be taught by trichologists over and over again. They said, Dani, go on and wash your hair. Dani, go and wash your hair. Don't stop washing your hair. So keeping up that routine is really important.
Thank you. Gillian, anything from hair loss from your perspective?
Same again as Dani, really important to get baseline nutrition completely correct. Selenium, zinc, magnesium, B vitamins, but it's the B complex. A lot of people really focus in on vitamins, and it's I explain it as your body's an orchestra, and you can have the drums beating very loud because you're taking a lot of your, but you haven't got your B1, your B2, your B5, your B6, B7, your folates. And so it sounds terrible and things aren't going well. So if you can get the whole balance correct of the right macronutrients in your hair, it can take 6 months. It will, and it is an investment of time to be able to see that growth and the changeover of loss to you know, and so it's painfully stressful for so many women, you know, even things like vitamin C, what was the other, vitamin E, really important. They're all, you know, there as essentials to make sure that the hair follicle has got what it needs to stop shedding.
Great, awesome. Okay, I'm conscious of time, so there's I have 2 or 3 other questions that again kept coming up. And it's back to, how can women seek clarification on whether they are perimenopause or not if the GP won't help? Or how are they actually going to find out? Because I think that's the stigma around perimenopause and menopause. The GP doesn't want to help. Now, hopefully that starting to change as they become more knowledgeable as well. But any recommendations on how women can seek help? Gillian, do you want to go first?
Yeah, well, yes, I think you're talking to probably, thankfully, a change over from the current wave of publicity that menopausal ladies have the benefits of, and it's fantastic because, yeah, so many go in to the GP surgery and it's like, well, are you having a period? Are you having any flushes? Right, no, everything looks good. Whereas there could be all the other underlying elements, vaginal dryness, mood changes, low libido, bone aches and pains, and the GP won't address any of those because they don't see them as necessarily hormonal. I think, though, that has probably been really highlighted to GPs, and they will take you more seriously, and they will trial you on low doses of HRT if you do get that. So I think it's about going and getting informed. There are several websites there, and I think Dani is an advocate of all of that. So it would be, you know, certainly Dani's area of being so focused in on the menopausal side of things. But yeah, educating yourself and making sure that you have your list, because brain fog is great when you go into the GP. You're like, oh my gosh, what did I want to ask? And you end up coming out going, I didn't ask any of the things I wanted to ask. So yeah, having the strength, the confidence and the knowledge, walking in and saying, actually, I want to discuss, I need these symptoms to be reduced. I need some advice. It may not be the HRT is the right thing, but at least you know you've gone in and asked the right questions.
Great. And Dani,
Well, actually, can I just add to that? Yeah, you know what's so brilliant about what Gillian just said? We don't need anyone else to diagnose our perimenopause or menopause for us. You don't need your GP. You don't need anyone else. You can do this yourself. Because guess what? When you were a teenager, you didn't need your mum to take you to the GP and for the GP to say, oh, yes, your 12-year-old daughter, 13-year-old daughter is going through puberty. No, it happened naturally, right? Same with perimenopause. If we are lucky enough to live to that time where our hormones go roller coaster and then start to decline, you're going to go through the perimenopause. You don't know when you're going through menopause, like Gillian said about an hour ago, because it's the day, a year after your periods have stopped. But if you're in your 40s, yes, I'm sure your hormone levels are going to do a little bit of a crazy thing. If you're going towards your later 40s, of course, you're going to be in perimenopause because your hormones will start to decline. So ownership back to you and each one of your clients. You don't need a doctor. And then there's a free, fantastic app that you can download. It's the Balance app by Dr. Louise Newson. It's free to download. You can download it, you can track your symptoms. It tells you treatment options if you want them. But if you just use it to track your periods and your symptoms, 3 months in, you might be a lot wiser as to what is going on with you. Ownership back to you. You don't need anyone. And then if you have the Balance app, you can then take a printout to your GP and say, actually, I've been educating myself. I'm well informed about the changes within myself. These are the things that are happening to me. I can put up with those. And this is what I need addressing. What do you suggest? So don't let anyone fob you off and go back and back and back. If you can't, the app was Balance. Someone just put that in. It's a blue square with a B on it. Balance app. And just be informed when you go in, and power to you. And many of my clients have changed GPs, some have changed GP practice. Your general practitioner is part of your healthcare team, whether you pay for him or her or not. They work for you. And so find someone that resonates with you and that can help you on your next steps.
Yeah, and I think as well, there's so much information out there now. There's closed Facebook groups for help. And I think it's just the support. Dani, I know that you are a real advocate and really championing this. So even following Dani is a great shout as well. Okay, one more question that's come in from Neve. Is HRT the answer? And if so, what stage should it start? What stage should you start HRT? Is that the beginning of symptoms?
Me? You?
Yeah, far away, Gillian, yeah.
So, HRT, absolutely, if you really have symptoms that you cannot control by diet, lifestyle, health, and health is okay otherwise, then absolutely using HRT is the answer. There are other things that ladies who have had no periods for a couple of years may wish to try instead. You need to discuss those and go down that route personal to them. But on the whole, the estrogen, progesterone that's fluctuating in our bodies that are causing our symptoms, if you've got those going on, then certainly there's an answer to it with HRT. And there's various options, pessaries, gels, patches, tablets, so there's many different varieties to suit your individual needs. I'm obviously at that stage, I'm 50 coming up, and I've forgotten the next question. So what was the second part of the question?
Was at what stage would you start HRT?
Yes, so starting HRT, you can start it actually with symptoms and having still your period. So there would be cyclical progesterone and estrogen would be there as a baseline. You can start HRT and you haven't had a period for 10 years. It really, depends on what you feel. Lots of ladies go through their menopause and just have real fatigue, real low energy, low sense of well-being, and a little bit of estrogen and progesterone low levels might just be enough for them. Other people really need the dosage to be, very strong and very significant, and they might not have it more than 4 or 5 years and decide that that's enough for them. So it really is very individualized, working with your GP to make it suit you and your health, because there are people who don't agree with HRT because the dosage is wrong, and that's a shame. If you get it wrong, don't go, oh, it's over, there's nothing you can do about it. Go back and talk about it and see what options may be, a different strength, different dose, different way of having it administered.
But also, I don't think you need to suffer. Do not suffer, because the world needs the menopausal woman, because we need to lead our communities, our societies, our countries, right? We need more women in our 40s and 50s and 60s and 70s, because we are beyond powerful. And if we let those symptoms stop us in our tracks, we're not going to be good to anyone, or yourself, or your family, or your work, or anyone. And so I don't think there is a right time. You don't need to have crippling symptoms to get help. Get help, try and make some changes. If it doesn't work for you, it wasn't right for you. There is no harm in just trying. I think it's another one of those narratives we have as women, that we need to maybe put up with it or be strong or to do it naturally, or whatever it is that we might have in our belief system. our aim is to feel well. However you get there, it's for you to decide. And most women that go on HRT, they still need to eat well to feel well. They still need to walk and move their bodies and exercise. It's definitely not the golden bullet, and you'll need to put lots of other things into place to feel well. It's a combinational approach, but don't suffer, because we need you. You need to do a good job for everyone around us.
Thank you. Well, I'm going to leave it there because that was a very powerful ending, Dani. And I can't thank everybody enough, Gillian, Dani, Linz, for jumping on with me today. Ladies that did join us, I hope that was really, really useful for you. We will share the PowerPoint that we have put together straight after this today, and hopefully we will also be able to share the recording with you. We will keep talking about menopause. I know that we will have blogs coming out about menopause, how we can help with that skin journey with menopause over the next 6 months. And also we have some really exciting new products coming in the next couple of months, which will also help with the menopause journey. So really, really exciting. I am absolutely delighted that you could all make it with us today. And thank you very much. We will chat very soon.
Bye.
Bye.
Bye, everyone.